I had been in a situation where I had almost completely stopped urinating. It was the standard of the classic symptoms of prostate problems were frequent urination, and you stand there and do very little. I finally came in, saw Dr. Cantwell, and the first thing he did was have me catheterized, where he drained, I want to say, 2,200 cc's. Mentioned that the bladder was really in bad shape at that time. So he left the catheter in and said that he wanted some time to pass for the bladder to go ahead and lose its irritation. This went for, I want to say, about a month. I came back in, and he did a microwave process. On the microwave process, when it was over, he recatheterized me and let it sit for a few weeks to make sure that all the scar tissue and everything were passed. Came back in, he pulled the catheter, filled the bladder up, and asked me to urinate, and I could not. So he decided to, he gave me my options, and one of them was the spanner. And that's.
Do you recall from your spanner experience, did the spanner, during the time that you were wearing it, help you to void? Did it improve your urination?
Absolutely, 100%. It was a situation where I was literally almost not going at all. And this put me back very close to what would be a normal situation.
During the course that you wore the spanner, that duration, what was, in your opinion, the best thing about that experience, and also what was the worst thing about that experience for you?
Well, the best thing is that it got me straightened out to get back to normal, to where I wasn't wearing a catheter bag and trying to work with that. The worst situation is, and this couldn't be helped, is that wasn't the end all. He ended up having to do an operation. But the spanner wasn't made for that.
Understood. Can you describe what it felt like to have the spanner in place? Was there pain or discomfort? What was the sensation with wearing the spanner?
It wasn't pain. It was a little bit of discomfort initially. It felt like, I want to say, a wire was pressed up inside you, and you could feel it. Not to the point of pain, but to the point of you knew it's there. And that went on for a little while, but that subsided. I don't know whether it's, I'm assuming it's just a point of getting used to it.
Can you compare and contrast what it was like for you to wear the spanner versus what it was like to wear the Foley catheter?
The spanner allowed you to conduct your daily life as close to normal as possible, where you could go to work and you would have the normal sensations of having to urinate. You would go and you would void, and that would be it. With the catheter, you were in the situation of having a bag strapped to your leg. It would ride down your leg, wouldn't sit right, it would move with your pants, and you just couldn't quite do everything at work that you normally did in the past. Having the spanner allowed you to get as close as possible to 100% of your normal daily life. It took you away from the bag, it took you away from having to worry about it, and just put you in a situation that was relatively normal. If I had a friend that was in the same condition I was in, I would recommend the spanner every time.